Hi, everyone. Thank you so much for joining us today for a conversation on a topic that is top of mind for all of us right now as school districts across the US and around the world embark on a school year that is under an entirely new, unfamiliar, and incredibly uncertain set of circumstances. I have the good fortune of knowing many of you who joined us by Zoom today, but for those of you who are new to us, I'm Donna McKay, the Executive Director of Physicians for Human Rights. Since March, PHR has been facilitating this weekly webinar series to elevate the voices of scientists and health professionals and advocates on a wide range of topics related to health and human rights and the COVID-19 pandemic. And today's conversation is the 23rd in our series. Our goal, as is PHR's mission, is to bring science-based analysis and approaches and expert voices working on timely issues every day to inform our own decision making and also to help guide response to this public health crisis. We have almost 400 people live with us today to hear from our expert panelists as they discuss some of the health and safety considerations that should be central to any decision about reopening schools for in-person learning, as well as the educational inequities being highlighted with the advent of, for many school systems, an entirely remote learning setup. And while we can't predict the full impact the school year will have on students, their families, and their communities, but for now, in the midst of this crisis, there are vitally important steps that we can take to protect public health and ensure that we're preparing for the future of our school systems through a lens that considers equity and access, and also what transparency looks like. So that's why I'm so honored to be joined by this group of experts today who bring with them firsthand experience as well as evidence-based insights and a real commitment to the health and well-being of all children. So I'm so grateful to have Dr. Ranit Mishori join us to moderate the discussion. Dr. Mishori is PHR's Senior Medical Advisor, and she is also a professor of family medicine at Georgetown University School of Medicine. She was recently appointed to the role of Interim Chief Public Health Officer of Georgetown University. During the pandemic, Ranit has played a leading role in facilitating PHR's partnerships with sister organizations working together to protect healthcare workers, as well as especially vulnerable populations. And Ranit has been a member of PHR's Asylum Network since 2006 and has served as an expert consultant to PHR's program on sexual violence in conflict zones since 2011. Ranit, I could go on and on about your role in human rights, health and human rights, but I know we're so anxious to get the panel started, so I'm going to turn it over to you to moderate this great discussion and just to say thank you.
Thank you so much, Donna, and thanks to everyone here today, both in the audience and our amazing panelists. You're going to be educated for sure through Zoom, like many kids and adolescents around the country. So as Donna mentioned, my name is Dr. Ranit Mishori, and I'm the Senior Medical Advisor at PHR, and at the moment, Chief Public Health Officer at Georgetown University, where I'm tasked with helping manage our university's COVID response. So for those of us leading pandemic responses at colleges and universities, the past few months, as you can imagine, if you read or listen to the news, have been quite intense. There have been reports of outbreaks on campuses, on sports teams, among students living in the community, and even at institutions that switched to full remote learning and expecting no one on campus. The threat of transmission on and off campus has kept me awake at night, as I'm sure it has many of you, checking the daily case counts, praying that weekend parties don't turn into COVID clusters, and considering the appropriate stick and carrot approach to getting our university community to adhere to public health recommendations. But also constantly reviewing and re-reviewing and rethinking our plans, wondering if there's some sort of a best practice out there, any guidance from anyone about how to keep our students, our staff, our faculty, and community safe. And I know this is the same issue for many of you in K through 12 education, and you're all doing the same and having sleepless nights. The difference between what I'm experiencing and what many of you may be experiencing is that by and large, when it comes to K through 12 education, the stakes may be higher. The impact on children and adolescents, on their families of not being able to go to school goes way beyond education. It's also, as importantly, about health and safety, It's about learning to socialize. It's about having access to food and special education support. So as we're seeing with institutions of higher education, educators and administrators in K through 12 education are also largely left to their own devices. We are lacking clear and consistent guidance from the federal government, and school districts across the US have been left to develop their own plans for in-person or remote learning, often without the resources necessary to implement them. So over the next hour, we will explore these issues, very complex ones, involved in reopening K through 12 schools and how they affect students, families, teachers, administrators, staff members, and the community in which they live and work. We will hear about the digital divide as well as the economic divide and how they impact remote schooling. We're going to hear about the idea of educational pods and how they may or may not exacerbate existing achievement and education gaps. We're going to hear about how and why access to broadband, Wi-Fi, and the hardware required to study remotely is topping the agendas of many municipalities and departments of education. We're going to hear about teachers and educators who suddenly find themselves involved in thinking about the physical structure of schools and engineering solutions. We're going to hear about the idea of learning hubs as a solution to getting kids together, but outside of a school setting. We're going to hear about all kinds of technological innovations and moving classrooms outdoors. But the bottom line is we're going to hear that there are no ideal solutions, and literally we are sort of flying the plane as we're building it. But the experts today will help shed light not only on the enormous challenges, but also highlight some of the solutions that they've been working on. So I'm going to start by inviting Dr. Heidi Schweingruber to start and give her opening remarks. Dr. Schweingruber is the director of the Board on Science Education at the National Academies of Sciences, Engineering, and Medicine, where her work involves K through 12 science education, informal science education, and higher education. She's an editor of the National Academy's report, Reopening K through 12 Schools During the COVID Pandemic. Heidi, please take it from here.
Terrific. I'm glad to be with everyone and thrilled to hear we have such a great engaged audience. I want to speak from the report that Ranit just mentioned, Reopening Schools During COVID. This is a consensus study of the National Academy of Sciences, and a consensus study is work that brings together a panel of experts to study a set of questions or a problem, look at the relevant evidence, and then provide guidance, a set of concrete recommendations for what you can do. This particular consensus study was inspired by folks in my network of educators who said in early April, oh my gosh, we're closing schools and eventually we're gonna reopen them. And how do we make those decisions? How do we understand the complexities? How do we take account the needs of communities and students and the adults in the buildings? And so it was absolutely the kind of problem that the National Academies needs to respond to in an evidence-based way, leveraging what was then known about the health issues, the epidemiological issues, and also the educational issues related to reopening. So I want to just highlight some of the key conclusions and recommendations in my opening remarks, but I can't go through all of them. I want to also acknowledge that Dr. Scarlett was actually one of the experts on the committee, and so she'll follow me and dig into some of the particular cuts from the report that are especially relevant for this discussion. The committee concluded overall that this decision, as we probably all now know, is fundamentally a weighing of risks, the public health risks and the educational risks to either reopening buildings or keeping buildings closed. And the committee was very careful to describe it as reopening or closing buildings because all school systems kept teaching. They kept providing education. They just went to remote or virtual. So the committee wanted to be careful not to imply that somehow education was closed. It was buildings that were closed, and therefore you didn't have in-person instruction. So the risks you're thinking about then are risks to health if buildings are open. Contrast that with and balance it with the education risks to only having remote or virtual learning, right? Or some blend. And so that's what the committee was digging into in a context where the evidence was moving fast and furious. So this was released in mid-July, and we already have insights from the mounting evidence that we didn't have then. So the committee also made a move to say that equity considerations must be centered, and Dr. Scarlett will expand on that in more detail, but the notion was you really have to think about that, because on both the health side and the education side, there are some communities who have been systematically locked out of good health provision and good education, and we know they're getting most hit by this pandemic in multiple ways. The committee recommended, when possible, when you're weighing those risks, trying to reopen for in-person instruction, especially for the younger students, K-5, and those students who benefit most from in-person, or in other words, will be the most affected negatively if they're only receiving remote or virtual. The notion was particularly the younger kids might have a harder time engaging in a sustained way in remote and virtual, and particularly often need adult support and supervision to benefit. And we can't assume that all family constellations and the demands of work are going to allow there to be adults providing that support for all kids. So in thinking about the health risks, certainly children's health was one of them, but at the time there was still sort of an emerging understanding of how the virus was impacting kids. But we can't neglect the fact that there are adults in the schools in all different roles, not just teachers, and those adults, a large percentage of them are in the higher risk groups, either by age or by pre-existing health conditions and things like that. So we have to think about that. And the place where we didn't have as much evidence to draw on, what are the implications for community health? When you open a school and you have all that contact happening, what does that mean for community spread? So the committee said school systems can't be left alone. In many cases, states, as Ranit mentioned, were not providing comprehensive guidance. Certainly the federal government wasn't. But the districts need to partner with public health officials to be able to understand how those risks come together. It's not really only an educational decision. So the committee was very strong on saying there needs to be a partnership. That partnership, the decisions need to be made in consideration of community needs, and that may vary widely by community depending on the level of spread, depending on the health infrastructure, depending on how many families are working, depending on what people know about the prevalence of pre-existing conditions in a population in the community. So it needs to be community-based. Then the committee also said if buildings reopen, here's the way to do it to promote health. The mitigation strategies that need to be in place, we know, we've heard them now: masks, social distancing, hand hygiene, but also ventilation and filtration, cleaning. One of the things that really came forward that I think merits some discussion is this issue of facilities. It really uncovers the wide variation in the state of school buildings and school facilities, and how much that's going to need to be factored in terms of how we decide whether schools can be open safely. And finally, the committee also said it's impossible to completely eliminate the risk. And I think that's an interesting public health messaging issue, is how do we communicate that people are going to get sick? And what does the school do? What's the response to that? How do we understand that, and how people are responding when someone does get sick? And I think I'll leave that as sort of the teasers, and we can certainly dig into the recommendations in more detail. And I'm going to hand it, I think, back to Ranit to introduce Keisha.
Thank you so much, Heidi. It was a huge overview, and I think for those of you interested in the full report, we put that in the chat, and it's worth reading. So I'm going to go next to Dr. Keisha Scarlett, who is the Chief of Equity, Partnership, and Engagement at Seattle Public Schools. She has served in multiple education roles, including as a STEM teacher and a district administrator. She is one of the authors of the National Academies of Science, Engineering, and Medicine's report that Heidi was just talking about, and has recently appeared on the NPR station WBUR in Boston to discuss exactly this issue and the specifics of the school reopening challenges facing communities of color specifically. Dr. Scarlett, the floor is yours.
All right, thank you, Ranit. So Dr. Schweinberger, thank you, Heidi, for just just sharing and kind of giving a little bit of overlay of the work that we did, really thinking about equity and also thinking about how do we leverage families and communities as part of a guiding coalition or decision-making body ongoing throughout the decisions that continue to be made in this situation around COVID-19 and reopening schools. And so one of the things that we grappled with in our committee was the fact that we all had a shared understanding about schools and their roles in reproducing inequality, and they always have done that. And so how do we both tend to the tension of equity throughout all of the decision making, but also really illuminate what's happening right now as we're navigating dual pandemics of racism and COVID-19. And so COVID-19 has really laid bare the inequities that have always existed. And as we fight these dual pandemics, it's really important for schools to acknowledge the historical legacies of structural racism toward particularly Black, Indigenous, and other people of color. And really to think about the disproportionate impact of COVID-19 on these marginalized communities. As we've seen, there's been a demonstration of higher rates of COVID infection, financial impacts, unemployment, and even death in our BIPOC communities. And so we find that our BIPOC communities also may have to be essential workers and are not able to have the protections of being at home and were exposed even more than others. And so as we think about our schools and the myriad of purposes that they, provide around nutrition and other basic needs, and just the impact of COVID-19 and school closure, particularly in the spring, and how that sort of cut off the access for our most vulnerable families to the basic needs and the supports and resources. So as we consider the realities that school districts need to focus on, we have to really think about equitable access in a few different ways. One of them is equitable access to decision-making. We know that oftentimes our most marginalized and vulnerable families are not part of decision-making tables. And so therefore their values and their interests and priorities are often not reflected in decision-making. So one part of equity for school districts is to really think about who is not typically at the table and to ensure that those people are at the table and that they have barrier-free access to being at the table for decision-making and ongoing decision-making for school districts. Another important thing for us to think about as far as equity is the distribution of resources. Because our most vulnerable and marginalized families may not have some of the access to different financial resources, how do we ensure that when reopening schools and ongoing, that families have barrier-free access to PPE and other resources, technology, broadband, the resources that maybe families with more financial resources would just have readily available for their students. And so it's really important for our school districts to pay attention to, again, the values, interests, and priorities, but the needs of communities. And that's why that guiding coalition or decision-making body is really important. And it's important to have ongoing engagement with our communities in order to really know what they need and how do they have access to in-language supports for families who may speak a different language around that as well. Then also ongoing, as we engage with school teams and engagement this fall, like I'm working in Seattle Public Schools, and we started in an all virtual environment, but there's no day that we don't talk about the opportunities of how do we provide in-person instruction, just to highlight what Heidi had shared before around our earliest learners, our most vulnerable students receiving EL supports or special education supports as well, and what are the opportunities for us to be able to transition into that. So lastly, as we think about the role that our districts play in really driving equity and in ensuring that we're really engaging schools and communities, this ongoing engagement, because this situation is going to change all the time. And the real inequality that we're facing right now is family choice. Families with resources likely have more choices, and then other families who may not have as many resources will not have as many educational choices for their students. So it's really important for us to work together with families and for school districts that have these priorities. So thank you.
Thank you very much, Keisha. And our next speaker is Dr. Mayra Levinson. She's a professor of education and a normative political philosopher. I want to hear more about that. Working at the intersection of civic education, youth empowerment, racial justice, and educational ethics at the Harvard Graduate School of Education. In July, she co-authored a New England Journal of Medicine article on reopening primary schools during the COVID pandemic. She brings firsthand experience as a former teacher in the Atlanta and Boston public health school systems. Mayra, please go ahead.
Great, thanks, Ranit. I want to hopefully build on and echo what Heidi and Keisha were talking about, and then in my role as a normative political theorist, which means that I think about values and what kinds of ethical principles might guide our work, particularly collectively, that's the political part. Name, I think, three challenges, I think real ethical challenges that we're facing right now. So just a bit as background first, I think it's really important for us to remember that while guidance documents are hugely important, and I love the National Academy's report, right? What right now, as so many of us know as parents and as educators and pediatricians and so forth on the call, every one of those grand guidance documents has to be implemented, right, in very particularized ways. And so there are about 14,000 school districts in the United States. There are over 130,000 individual schools. And when Heidi was talking about opening buildings, right, that means that there are over 130,000 individual buildings, right, that people are having to make decisions about and figure out, is this particular building safe for us to open, particularly now taking into account how children are going to get into and out of those buildings, right? How are the adults when you get to the buildings and leave the buildings, who are they going home to, things like that, right? And so that's one of these humongously challenging features, is not only do we lack appropriate federal guidance, and so many of us are like, you know, trying to come up with stuff, scrambling to come up with scientifically based guidance on our own to help people out, but then it has to be implemented and figured out at this enormously local level, right? And then as Keisha was discussing, it's not only then say, what does the school district or even the individual school leaders decide, but then what do the families individually decide, right? It may be determined to be safe for a building to open and for children and educators to enter that building, but what about my kid? What about my family? What if I am in a multi-generational family? What if I'm worried about somebody who is particularly vulnerable in various ways? And then how do we manage and take account of and respond to the patterns of choice making that we see, right? So right now, the patterns of, we're seeing at least two patterns of choice making that are, I think, totally rational and reasonable, but also reinforcing the inequities that you know, both Heidi and Keisha talked about, that we have baked into our society, right? So one of those choices is that we are seeing that schools and districts that disproportionately serve higher income families and white and Asian families are reopening, at least in a hybrid way, more than we are seeing the largest school districts that disproportionately serve Black, Indigenous, and other people of color students and low-income students. And that's rational and reasonable because we have allocated resources to schools and to districts in vastly inequitable ways now for centuries, right? And so in fact, the independent schools and the smaller schools that serve a de facto segregated, higher income and whiter population are in fact often prepared more to open in a hybrid fashion or even fully in person than the larger school districts that have had deferred maintenance for decades, that have been underinvested in for decades, et cetera, and where also the kids and the adults often rely more on public transportation. So these choices make sense. However, they are reinforcing the unjust inequities that we have built into the system. We are also seeing those differences and choices at the level of families, right? So when you look at surveys that are done of families about what their preferences are and how likely they are to send their own children back to school, what you see is that higher income families and white families, and to a lesser extent Asian families, are much more enthusiastic about reopening school buildings and sending their own children back into the schools than we see from low-income families, and especially Black and Hispanic families. And again, I think it's utterly rational for us to see those differences because of relations of trust and mistrust, and who has gotten served historically by public educational institutions. White families and more resourced families get served far better, right? Those institutions are much more responsive to them, take into account their interests much more readily than low-income families and Black and Hispanic families, who are often silenced, marginalized, ignored, told that we know what to do with your kids, et cetera. And so there are way worse relationships of trust there. But what we see then again is then this exacerbation of injustice and inequality built on those historical phenomena that I think Keisha was talking about. And it just further exacerbates it. So I think this leads us to three problems, which I'll name really, really briefly. One is, I think we have this wicked problem that back to school in person is better for most students. However, as Keisha was mentioning, it's not safe if we have high levels of community transmission, poor school building, facilities and so forth, and low levels of trust. And so we have this question of whether the schools that serve the most vulnerable kids should in fact be putting more of their resources into planning for and providing remote education, despite the fact that we know that that's worse for most kids, than putting their energies into planning for and trying to deliver at least partially in-person education, given the disparities that we see. I think the second concern that we have to wrestle with is whether or not we should actually be leveling down or leveling up with respect to equity. One of the things so there are two ways you can try to achieve equity. One is to try to lift people up to the level that whoever is at the highest level is at. The other way is to try to pull people down to, say, whatever level the lowest people are at. Normally, we try to level up, right? But as we are thinking about problems of educational equity in the pandemic, what's interesting is that you see some movement toward leveling down. For example, in Maryland, when the public schools couldn't open, and then there was a sort of back and forth about whether or not private schools could open. Right, and for at least a little bit, the answer was no. If the public schools in your community aren't opening, you shouldn't be opening either. And the private schools reasonably said, but we're equipped to open. Why would you level us down? Why would you force us not to provide services to our children that we're prepared to provide just because the public schools cannot do it? And in the end, the answer was, okay, you go ahead and open. But what that's doing now is really increasing the inequity. And I think there are interesting questions about when, if this is the time, if ever, that we should think about leveling down choices and why. I'm not coming out in favor of them. I'm just saying that this is something I think we're dealing with. And then the third question is about the path dependence of the choices we make. To what extent do we make choices now, whether that's about investing in Chromebooks versus investing in more school buses, or investing in remote curricula versus investing in hiring extra teachers and school nurses to enable opening, right? To what extent do the choices we make now decide some of the paths that we go down for the future, not only across the course of this year, but potentially into the future in terms of our long-term commitment to certain kinds of remote education, outsourcing of education, training of teachers who we're going to serve, compensatory services later on, et cetera.
Thank you so much, Mayra. And our last speaker, Dr. Sarah Bodie, is a primary care pediatrician and the medical director of Nationwide Children's Hospitals Care Connection School-Based Health and Mobile Clinics. I thought I would not be able to say that. It's a mouthful, but here I was. Success. Dr. Bodie serves as on the executive committee of the American Academy of Pediatrics, the Council on Student Health of the AAP. She recently appeared on Good Morning America to discuss school reopenings during the pandemic. Dr. Bodie, please, let's hear from you.
Great, thank you. So I would echo again our other three speakers. We are seeing locally in our community just what you mentioned, Mayra, around this inequity with some of our more suburban school districts versus urban, and we have a reflection of those inequities in our education system as well. And what I wanted to focus on is we also see that same inequity exacerbated by the COVID pandemic around healthcare access too. So we know that schools are more than just places of learning. Schools are so many things for so many kids. As Ranit mentioned at the beginning, they're places where they often are getting therapy services, they're getting food, they're getting exercise, a safe place to be. And in many cases in large urban districts, they're actually getting health services right on site. So they're getting, mental health evaluations and therapy, school-based health centers that are open that are providing, again, that access to medical care for families that may be challenged by getting to regular medical home visits. And so we're seeing this disparity as well in our local community and nationally around healthcare access too. Additionally, these families are often the ones that are most affected by the pandemic, whether that's with a family member that's, suffering from COVID-19 or just the economic ramifications. So thinking about those marginalized populations and what that means for their insurance status for both the kids and the parents in that family, and whether that's also disrupting their ability to, again, access needed ongoing health care for their kids. And so just at a time when they're getting more cut off from their education system, there's a real possibility that's happening in the healthcare sector for them as well. And so that's a concern for us around school health in general, and what can we do to help partner with the education system to be a part of the solution. So for example, this is the reason why the AAP made the policy statement that came out that said, really the end result should be, keeping in mind a focus on returning kids to in-person learning, but of course only able to do that when it's safe. And we heard all the challenges there may be with schools and getting that done in an equitable way. And that's definitely there. And so what the Academy has thought about and is partnering with the education system on is, what can we do as pediatricians to kind of help partner to problem solve around some of those issues? So an example might be on-site services. So even if you're in remote learning at your school district, some districts are looking at opening up to be community schools at that time. So can they be opening other services that may be happening to a smaller extent for those kids and families that can get to that area? So for us, what that could mean is we have vaccination clinics is a great example. So vaccination clinics opening up at area schools where families know it's there, it's easy, they can walk in and get what they need in a distance safe manner with all of the PPE provided for them. We do well child checks as an example right inside schools, even if they're not in session, so that again, we can still improve that access. For kids that are on an IEP as an example, and they need really in-person therapies, whether that's physical therapy, speech therapy, occupational therapy, are there solutions we can come up where we're providing some of those services in person during this virtual learning time? And these are all things that are getting worked out, as everyone mentioned, building by building, locally with each district, and look different with every single one. So what is able to happen and potentially is happening in one district might look very different from another. But those are at least ways that can work with them. Someone mentioned the HVAC, and that's been a huge concern for us with some of our local under-resourced schools with really no air conditioning, let alone, you know, really good ventilation. So thinking about what we can do to help partner with that. So whether that's outfitting some areas with air filtration systems, in addition to that, and can we partner as the healthcare entity with the education department in our local schools to kind of think about how we might help with some smaller cohorts and areas where we can have those services happening. So that's just one small example of just an innovative, creative way to kind of meet in the middle somewhere to try to get some help for these students. I will say long term, this is going to take systems change around our education system and the way that we're providing these services. And it's also going to take healthcare change. I mean, right now in our healthcare setting, we also operate in a fee-for-service, very structured way that often does not meet the needs of our most marginalized populations. And so as a pediatrician, I think about, okay, these are the patients coming in through my doors, but who hasn't shown up? Who hasn't been able to access that care? And then what are we doing to provide care to them in a different way that meets them where they're at so that we do have equitable healthcare access? And one of the biggest ways that we can do that for kids is around school-based health. And so really just continuing to support and maintain that connection between schools and health so that we're having some of those co-located services and conversations and even just really support. So having, you know, physicians, pediatricians, other healthcare providers be able to work with school nurses and help support, you know, their policies, their outreach, thinking about how to continue to meet the needs of these families during this time so that we're kind of thinking about the whole picture is just another layer of challenge that we're working on right now during this time.
Excellent. Thank you, Sarah and everybody. I think we're already getting some questions from our attendees. So I'm going to start with a question that perhaps Keisha would take. But everybody talked about how essentially, I think that one of the messages here is it takes a multi-sectoral approach to open a school. But the question here is specific to public health. So can panelists please comment about the essential role of governmental public health in guiding and overseeing how schools are protecting their employees and students from COVID-19. So what is the role of public health, and how, I would expand that question to how does public health and the government, whether it's local or federal, how do we work together to make sure that we adhere to safety and health guidance?
Yeah, I can start with this question, and I'm sure that Heidi might have some more expertise in this area. But public health does play a really key role. Our report really talked about how public health needs to work with local school districts in using the different guidance we have in Washington State, and many states have maybe local educational authorities working with public health at the state and county level together with schools. It's really important for us to track infection rates. Many of these decisions to open schools, whether for hybrid or in-person learning, are really based upon local decision making. And so one of the things that we're facing across the country is that many schools that have been able to open also are parts of cities and interdependent with cities that have really adhered to mitigation strategies and to the quarantine like strategies and using PPE. And so schools are just a microcosm or a reflection of sort of a greater, public health piece, but made even more vulnerable, with our students within that. And so places where schools can't reopen are often places where the citizens are not adhering to the guidance from the medical field and from public health around just the basic precautions around social distancing and maybe staying home when you can, or wearing masks at different times or different phases from that. And so schools are definitely vulnerable. I would say that interdependency in these localized ways of working with public health to be able to track data, making sure that you have school officials that are in constant communication and looking at that information around infection rates that are happening, and infection clusters are very, very important. So I cannot reiterate enough the interdependency between schools in the cities and towns that they're in as well, that are really impacting what's happening with schools right now.
I can just add really quickly, The committee did call out specific ways that public health officials and offices should be working with the schools, and it'll really vary how much these partnerships already exist or not, right? Because school systems operate in different ways across the country. But the notion was helping to create that decision tree that's going to be informed by constantly updated data about community spread, looking at schools' plans for mitigation strategies and being able to give advice on whether these are really realistic plans or not. I saw a comment somewhere about, can you just use plastic face shields? And the evidence is, no, that's not really the right way to mitigate. You need an actual mask. So things like that, where a public health official would immediately pick up on that in a plan. We also did call out another source of inequity. Some public health offices are very under-resourced, especially in rural areas. So we actually called for states to recognize that unequal distribution of public health expertise and resource, and think about how you're going to make sure all districts have access to that. So that you're not calling for this partnership to happen, but then you have some locations across the country where there actually may not be the deep understanding of infectious disease, for example, that you might need to be able to be looking at plans in the way that you'd want to. So those were just some specifics.
Another question that we're getting goes back to the issue of inequities and the decisions that we're making right now. How will they impact the path in the future? And I think all of you mentioned that this could be a situation where this is an opportunity to reimagine the school of the future and what it looks like. From one of the questions is about, can we advocate, is this a good time to advocate for smaller class sizes and hire more teachers, especially for marginalized populations? So I guess maybe the broader question is, how can we use this crisis to reimagine a better path forward? And maybe Mayra, you want to take that? But anyone, please, you can chime in. I know all of you are thinking about that.
Yeah, so I have sort of, my realist side is fairly pessimistic about this, although, you know, I can sort of imagine possibilities, but so I think, I mean, unfortunately right now, like I worry that no, this is not, I mean, yes, this is a good time to advocate for, say, smaller classes, additional teachers, social workers, nurses, right? You know, guidance counselors, all of these things, except that right now, states, right, are under these enormous budget crunches, and by law, most of the states have to balance their budgets, and they don't have it. And the federal government is not coming in right now with the resources that states desperately need. And, you know, education funding in the United States is inherently state and local. About 90% of the funds coming to school districts in the United States come from state and local sources. And we have this bizarrely regressive system of funding in the United States, where the districts that serve poorer children generally have fewer resources available to them than the districts that are serving wealthier children, which is different from almost every other country in the world, rightly so, because it's a crazy way for us to fund schools, but that's how we do it. So right now are the schools that are serving the least served students and who are suffering under the inequities that we're talking about, are they in a place to like massively increase the services they have to offer? No, not unless we have really serious federal attention to providing short-term resources and long-term resources to states and districts. On the other hand, you know, yes, there are some opportunities. I think that as, you know, all educators are realizing that they have to focus in on what's really important to teach and learn, right? And so it's possible that actually streamlining the curriculum and really thinking about what is it essential for kids to learn may have long-term effects of our actually making what we try to teach kids more rational. I also think that the increased attention to all of the services that schools provide to kids, and to the fact that schools feed kids, they provide medical services, they provide therapeutic services, they provide dental care, mental health care, you know, they, you know, looking for abuse and neglect, etc. Like all of this stuff happens in schools, and that kids deserve this, and that they deserve to have these services regardless of what's going on in their schools. hopefully we can continue taking that seriously and increasing services along those lines. And then the other thing that I will hope is that as schools have learned more from families about what is going on with them and have been forced to be more dependent on families as co-educators for children, that when children move back into school buildings over time, that the schools will continue to respect the work that parents do and continue to reach out to them and listen to them. If we can get a more co-equal partnership between schools and parents and communities around children's education and development and well-being, that will be to the good.
I like that.
Speaking, you go ahead, Keisha.
Okay, great. And I agree with everything Mayra said. She just highlights so many things. But I'm also thinking back to Sarah when she began to talk about community schools. And community schools do supply many of the things that we talked about, health related and wellness related as well. But our very best community schools also become entry points for community. One of the things about this COVID-19 pandemic and us reimagining education is this opportunity to freedom dream. Schools have been sites of trauma for many Black and Indigenous students, particularly in this country. And so how do we return the education of our students back to community? That the education of our students is not just a school effort, it is a community effort. It is everyone, all stakeholders deeply invested in the well-being of our students and then moving on to be, great citizens of our cities and states and of our country as well. And so there are opportunities for us to freedom dream about schools and what does it look like to have schools? We have an 80+% white teacher population, mostly female. So when we have such a level of disproportionality between the students that are actually served, they don't actually have representation. One opportunity with community schools and this community effort is how do we open our schools to our community providers and really work with our community folks in order to provide enriched education for our students, particularly students who do not get to have a chance to have the educational representation for them. That students need instructional belonging, and oftentimes our teaching corps are not equipped to really provide the instructional belonging that really is outlined in a body of work by Dr. Guli Muhammad around we need to teach identity, skills, intellect, and criticality. And that criticality right now amid Black Lives Matter, amid protests, amid COVID-19, our very youngest learners need to really learn and understand our system, what it means to be an anti-racist person in the system, and how to really enter and think about the work what they're learning through a critical eye around criticality in order to make change. So recognize, but also make change both as young people and as citizens in this country. So I do think that there's an opportunity for some radical reimagination of our education system right now.
Yes, and then the whole idea that it's very difficult to teach some of these issues at home, and you need experts like yourself and others to teach some of those ideas and the critical thinking involved. I wanted to switch to a really important issue, and maybe I'll give it to Sarah first, but anyone here can talk about it with great expertise, is the issue of mental health. And as you know, the mental health of the nation is actually under threat because of the very, very unusual situation that we're under. So the question here is, all students are struggling with mental health. What recommendations do you have in regards to addressing the mental well-being of all students during distance learning? And another question is, what are you suggesting for parents? Their own mental health, as we've heard, it's so incredibly difficult to work from home and manage kids crawling around and having to do their homework and have to help them with the technology and with the content. What are some suggestions for parents? So Sarah, maybe you can take that, and anyone else, please chime in.
Yeah, absolutely. So one of the first things I'll say is that we have absolutely seen in the pediatric population that kids have been struggling with some of this social isolation, particularly teens who need that peer interaction and are wanting that and really struggling to find that. Also, you know, attached to your mental health is your sleep schedule, your exercise schedule. So again, kids that are maybe living in urban areas that have less access to open play spaces or ability to get out and are using more screen time now during this pandemic, both during school hours, but then even afterwards, can also suffer from that as well. And so one of the first things I would say is that mental health needs to be something that's talked about and addressed frequently with students. A little bit more challenging to do for teachers virtually. So seeing or noting that someone seems to be, you know, suffering from some depression or anxiety through Zoom may be more challenging. So it might be even more important for parents to kind of be clued in and checking in with their children frequently and really having open, honest discussions about their mood and how they're doing. And some of those other signs. So are their kids seeming more socially isolated? Is their sleep pattern off? Are they having, you know, less energy than they used to and they're not interested anymore in enjoying some activities they did before? All signs that they should be taking them to, you know, talk to someone and really bring this out into the open. And then parents for their own mental health too. I mean, understanding that they may need those breaks as well. So I will say that I'm a working mom. I have 3 kids that are in a hybrid model with school right now and work from home with them here. And it is definitely more stressful during those times, absolutely no doubt. So again, understanding what you need. What are you doing for mindfulness? Are you taking breaks? Are you getting your own exercise? Like, what are your coping mechanisms? And what can you do as a family during this time for that as well?
Another question that we're getting, and this relates to an editorial I read last week, is basically calling this generation the lost generation because of these issues with education. And the question we're getting here is, teachers in schools report that they lost 20 to 25% of their students when in-person classes were curtailed last spring. With many districts not reopening in-person classes, what guidance has been provided for tracing these lost children and assuring that they're receiving some education? Any idea of how school districts are, maybe Keisha, how are you finding these people who kind of don't show up for their Zoom classes and it's hard to track them and trace them?
Yeah, well, one of the things that we haven't talked a whole lot about that Mayra spoke about before is just the burden on families to suddenly show up and be educators or be teachers. We do recognize that families are the first educators of their students. However, they haven't gone through formal training to teach their students. And we find ourselves completely dependent upon families, from the devices for students, the electricity in the wall to ensure that they're charged, the broadband, everything we need in a partnership with families right now, particularly in school districts like mine that have started out in virtual environments. And so with that said, these children aren't lost. They're with their families. They're safe with their families oftentimes, and families are making different decisions about what to do with their students educationally. Do you imagine that this could be your child's kindergarten year? Is this how you want school to start for your child? We're finding that we have a lower number of kindergarten students than what's enrolled that have showed up before, that have been showing up as school is now in day 3 or so in Seattle Public Schools. And so these are real issues. And also I do want to highlight the fact that I think for mainly families, people of color, we make it seem like their homes aren't places where their students learn and their children learn, and that we need to sort of evacuate them from their communities and from their homes to bring them into school so we can do the right thing with them, to educate them. And it totally invalidates the learning that does happen from home. And I'm not suggesting that all children should move to be homeschooled, but there are some families that are making choices to homeschool their children right now because schools have been sites of trauma and they see joy and play and other opportunities for community connection for their students as well. And so our district procedures, I think, around this is that we find that in virtual environments, at least, you don't need as many adults to operate in virtual environments as you do with schools. So families really want to hear from the educators and the school leaders. We could try our central office efforts to engage families, but really it starts at the school site. So having family educators who are not necessarily teaching in that time to call families, even to show up, I think at doors are really important. This is this moment in time where we need to let families and students know how essential they are, how important they are, how valued they are in building relationships and connection with them. And those are the things that I think will help increase engagement, along with just still trying to alleviate just the issues of maybe technology access or devices and, you know, broadband. There are just myriad of different barriers that families are experiencing, I think, in order to be able to be connected. But I do want to reframe the lost and just add another perspective into what's happening for our children.
Excellent, thank you. Yeah, absolutely.
Yeah, I mean, to add to what Keisha said, I think that there's this challenge about where do we anticipate the greatest barriers are going to be, and then how do we make choices then about how to allocate resources to sort of preemptively or proactively address those barriers. And unfortunately, you know, we can't proactively address every barrier that we anticipate. So is it that we are trying to invest in broadband and, you know, getting mobile hotspots everywhere and buying Chromebooks and so forth? Or are we trying to invest in teacher professional development to help them, you know, do a better job of remote teaching and say remote assessment? Or are we trying to invest in, say, getting the kinds of services like meal services and medical services that are normally located in school buildings dispersed throughout the community, right? And these are all choices that we make. And when we're talking about kids who aren't checking in, right? And we don't know until we talk to the families about whether or not that's because the parent has understandably decided being on Zoom is not the right way for a 5-year-old to learn, right? So I'm not going to make them be on Zoom. Or is it because they don't have a device? Or is it because they have the device and they want their kid to participate, but they are simultaneously working and they weren't able to do the triple checking to make sure that the kid, you know, clicked in the right place? Those are 3 very different reasons that kids may not be going in. The one way preemptively to address those questions is, as Keisha said, by reallocating staff time to making those one-on-one connections with families through text messages, through phone calls, through physical visits, etc. But if we're going to do that, then we cannot expect, say, those same personnel to be on Zoom for, say, 4.5 hours a day, right? And so that's part of what we also have to decide at the district and at the school level is, what does good education look like? And when our educators are trying to provide a good education, do we judge them by the number of minutes they are in front of a camera? Or do we judge them by, say, the diverse kind of outreach that they do to the students who they feel responsible for and you know, in serving them? And there's a real tension there because there are good reasons, again, on multiple sides to value each of those things.
Thank you so much, Mayra, and everyone, and Keisha and Sarah and Heidi who had to leave us. I think we're almost out of time, and I know that we're barely scratching the surface of all of the issues that can come up and have come up when it comes to K-12 education and sort of reimagining the future of education. And I loved Keisha's term, I think she said freedom dreaming. As a human rights organization, Physicians for Human Rights is human rights dreaming the future, and we work hard to promote universal rights, such as the right to education. But we recognize that at this time in our history, sometimes the right to education and the right to health and safety may be a little bit at odds. So I'm gonna send this discussion back and for Donna to sign off and talk about and just give some suggestions for future action. Thank you so much to everyone for your participation, for your expertise. Thank you for the many questions that we received that we can't respond to, unfortunately, but clearly this is a topic that is on everyone's mind and affecting everybody's day-to-day life. So Donna, please take it from here.
Oh, thank you so much, Ranit. That was an amazing wrap up. I really want to thank you for moderating this very important conversation today. And also a big thanks to our panelists, to Sarah, to Keisha, Mayra, and Heidi, for bringing us your keen understanding of these issues in this conversation. And importantly, for bringing us your recommendations, what our future should look like. In a very brief 55-minute period, you managed to cover an enormous number of issues and left us with just more to talk about. And I'm sure we will. And, as all of you pointed out, schools are more than just a place for education. They're a microcosm for society at large, representative of the COVID-19 challenges and disparities in full display in all of our environments, but also how to use schools for providing services related to addressing access and equity for COVID-19 response. This is a really important lens, so thank you for bringing that up. And it really, to me, indicates the role that parents and community leaders can play on a very real and practical level in addressing COVID response overall. And even how we can use this crisis as a path forward to imagine and create a different, more equitable system for education. So thank you, Ranit, for raising that conversation. I loved, as Keisha described it, a radical reimagination of our education system. You really provided, all of you, an important perspective on how the COVID experience can provide an opportunity to achieve reforms that have not happened previously, but should. So we're grateful to have your leadership and your advocacy in this field. You are amazing. You gave us great ideas for policies and practices and very practical actions that many of us participating in today's discussion can do. For those of you who join this conversation, one thing you can do is share this conversation. The session was recorded and it will be available on PHR's website shortly. So if you know of people who are in positions to act and or are interested in learning more, please share that with them. Another action you can take is to sign up at PHR's website to receive updates about our COVID-related work, which also gives you plenty of opportunities and a platform to make your voices heard, lots of actions. So if you aren't a member, please do sign up. And then just join us for future conversations. This is such an important time for us to stay informed and to have trusted voices. Next week, Thursday, same time, join us for a conversation on COVID-19 threats to workers in food processing plants. Anna Werner, who is a national consumer and investigative correspondent at CBS News, is going to moderate this discussion with another great group of experts who will look to shed some light on a very much underreported and untenable situation for a very vulnerable population. So you can register here on this webinar link or on PHR's website. So thank you again to our amazing group of panelists for this conversation. We're so grateful to you for the work you do every day and for your advocacy. Stay safe, everyone. Hope to see you next week.
Thank you.
Thank you. Thanks, everyone.
Thank you, everyone.